So the topic that we would try to address now, although we can still continue to address any issues which people still have, is vaccines. And some people have a question as to whether or not vaccines play a role in transverse myelitis. So what I first want to do is have a single representative for each child raise their hand. So I know how many, give me one caregiver or parent for each child. Everybody, okay. Now, how many, you guys have two, I see both hands. Oh no, okay, you're fine. Now, no cheating here. Now, how many had a vaccine in the 30 days preceding the onset of transverse myelitis? If so, keep the hands up. Okay, so that's quite a bit. That's probably 7 or 8. Now, of you people then who have your hands up, how many think that the vaccine actually caused the transverse myelitis? Couple. It's unclear. Questions could go either way. Okay, so we've got about probably 3 or 4 people at least. Vaccine stimulates an immune response against the infection, against the vaccine, which then cross-reacts in some way which we don't quite understand and causes the inflammation that heralds transverse myelitis. Truth is, we don't know. If we try to do a statistical trick to say in that 30% of kids had transverse myelitis, what would the by chance incidence be? What if we just said, what's the statistical chance, if there's no relationship between the two, that a child would have been vaccinated within the preceding 30 days? And it's much lower than that. It's probably 6 or 7%. So the answer that I say, and I want to hear what everybody in our panel says, I don't know. What I truthfully think is for the vast majority of the world, vaccines are very safe. Vaccines save lives. Without vaccines, we'd be a lot worse off. Having said that, I can't preclude the chance that there is, in a very rare individual, an association between the two. That's where I am. So the only way, in my opinion, to answer this is to do a prospective study. It's called a case control study, which we're now starting. To look retrospectively is never going to answer the question. Because to look retrospectively, all of you have probably done this. The transverse myelitis occurs, you then search. You search for the things that could have caused it. And you all probably come up with different ideas. Some cases it's a vaccine, some cases it's a cold, some cases it's lead, some cases it's some particular activity that was done. And they all may be different, and that's a logical thing to do, is to search for something which gave rise to this. And none of them, or many of them, may actually be causal in the transverse myelitis, but we just don't know. So, in my opinion, the only way that we're going to understand this is to go forward prospectively with cases and very closely matched controls for the same age, same sex, same exposures, and ask the question if the cases are more likely to have had a preceding vaccination than these closely matched controls. So we're doing that at Hopkins, and we're starting to enroll cases now, but unfortunately I don't know any more than that. Do you want to comment?
I guess a question, maybe as a college. I know there's that National Fund for Adverse Reactions to Vaccine. Has anyone, if anybody knows, ever filed a claim under that? Have they ever been ruled on as to whether physicians or the mediators or whoever runs that have said, we think that was caused by the vaccination?
Who knows about VAERS? Anybody? Some. Vaccine Adverse Event Registry, set up by the federal government to get a handle on these adverse events. So, and this is, anybody can enter data, physician or not, into VAERS. If you go on the internet, you just VAER, or Vaccine Adverse Event Registry, you'll come up with a website and can enter data into that. It gets looked at by people in the FDA, and I'm actually on the federal board which oversees this. The corollary to that is there's the VICP, the Vaccine Injury Compensation Program. in which money is dispersed from the federal government to people who have been judged to have had an adverse event from a vaccine. The reason for that was to shield the vaccine makers from liability, because a single case would be millions and millions of dollars. The vaccine makers don't make a whole lot on the vaccines. They would all say, no, we're not going to make any vaccines. From a sociologic perspective, that's not ideal. So the federal government has done this kind of shield. The answer to your question is, has anybody been given money from the federal government for a relationship between the two? And the answer is yes. It's a very complicated, sometimes ugly process, whereby it's almost like a legal case, where the government gets witness involved, and the child who's been injured gets witnesses involved, and they talk together, and there are lawyers involved. But yeah, they have. It's difficult because what you usually have is event A, event B, that's it. Did event A cause event B? And there's no more than that. And so then you just get people talking. And without data, you don't know. What you do know is that vaccines can cause neurologic events. So Guillain-Barré is one which has been clearly associated with preceding vaccinations. Even so, we're talking huge numbers of patients to identify a risk. And what you end up with is maybe 1 to 3 new cases of Guillain-Barré per million vaccines. And that's the clearest association. I mean, that really is been worked out statistically. Most people believe it, although many of the newer vaccines, there has not been an association. This was back into the 60s and 70s, actually. So and that's the clearest association. Some more studies have been done recently with multiple sclerosis. There was a lot in the French literature about an association between a hepatitis B vaccine, as well as others, but mainly hepatitis B, and an initial presentation of MS or an exacerbation of MS, both of which have pretty clearly been ruled out. At least in statistical terms, there is no increased association. To my mind, that's great evidence, but it still doesn't say whether or not on a rare individual with a particular predisposition there might be an association. Just don't know. So yeah, and people who think that there has been association should go to VAERS. They should look at that. They should enter that data. It's not censored by anybody, right? So that's good and bad. Anybody can enter it, but you can put anything you want into there. And as a result, to go and mine that database for information is very hard. There's no keywords that are, or there's no criteria for a link between the two. And so it's hard to kind of mine that for valuable data, but people should use it and look at it.
Yeah. One comment is just that each vaccine is different. So we tend to lump vaccines all together, but recently the government looked at hepatitis B specifically for demyelinating diseases, Guillain-Barré, MS, Transverse Myelitis, and they found no statistical association. That's not surprising. But there are lots of other vaccines that really, you have to look at them individually, because the risk of them causing a permanent neurological condition, the timing of it varies with each one. So in some, you may say some of the antigens might take 3 days before you would be able to say it's an immunological response. You see others maybe 7 to 10 days. So think about them all, I think, separately rather than lumping them all together.
Now, for those who have thought about a relationship between the two, even if it's unclear in your mind, are you giving subsequent vaccinations? You have not. You have? One at a time. Do you? So instead of, what would normally happen, which is where you get huge numbers of vaccines at once, you give them one at a time. Okay, I think that's smart. Now, the other thing that I say to do is, if there is if there's a personal history, it's really up to you. This is something we don't know, and I can't say, go give it. But I do say, I would recommend getting the vaccines. I don't recommend getting it if the child is sick at the time. If there is an ongoing immune response, fever, fussiness, irritability, I know the American Academy of Pediatrics says do it, go. The reason for that is that they've got you there at the pediatricians, and you're going to get it there. If you say no to that, you're going to lose a lot of immunizations for kids. But I say, best wait until there's not, bring the child back.
Are there any data as far as initial event and then you take the vaccine and get a second event? I assume that's non-existent.
That is non-existent, to my knowledge, is a case of transverse myelitis. Somebody can correct me. A case of transverse myelitis with a preceding vaccine within the last 30 days. That family then goes and gives the same child a second vaccine, and a recurrence of the transverse myelitis occurs. Does anybody know or heard of that, or chat groups have heard of that? Anybody seen it?
I guess we should use the mic. So, I guess no, I haven't seen that. But what I wanted to ask Doug, and maybe related to that, is the question about whether you should immunize siblings, given that you've had one child with transverse myelitis, and if one of our pathophysiology questions is there a genetic predisposition in the immune system to developing these reactions, how should we immunize the other children? Doug, what are your thoughts on that?
I have never seen 2 events of transverse myelitis in the same family. Oh, no, that's incorrect. One time I have, but it's very, very rare. I've never seen siblings get transverse myelitis. So, and in fact, the story I told you about was Morgan Gertz, who's a twin. Although it was a fraternal, it's still, closely genetically linked, and one child got it and the other child didn't. So my take on that is I have no evidence to think that siblings are more likely to have transverse myelitis or indeed any neurologic sequela. So I say go. I say go ahead and give your siblings. I mean, I really think that the ramifications of not vaccinating your child can be very, very significant. We tend to underplay it, but it can be very, very significant.
Kind of the one that's hovering out there for us, and we ultimately, and we've talked about this at some of the other conferences, I believe Mary Kate has gotten the typical vaccinations, although we split them up like Kathy said. We didn't do, what is it, NMR, we split them up at a different time. Is the chickenpox one, which she's now 7, and a lot of people are getting it. In Illinois, they're going to, although you don't have to, you can opt out, I guess, based on your medical professional's advice, but they're pushing it as a state requirement in Illinois, and we're like on the bubble. Now she's getting older. If she does get older, it might be worse. Is she going to have a reaction to that versus getting that vaccination? We still haven't done it. That's kind of the one for us that's kind of out there, other than the typical vaccines. We're kind of still looking at what we're going to do with that.
I think that's right. I mean, I'll be interested to hear what other parents have done with that. I mean, measles will kill you. Mumps will kill you. Chickenpox won't.
In the young.
What's that?
In the young.
In children won't. And it's very rare to get neurologic sequela of chickenpox when you're a young child. As an adult, it's still rare, but it's more common. And so, yeah, I mean, I think that's a question. I can't answer that. Greg, what would you say?
Well, so I tell you what I did with my own kid, just to give you an example. I personally think that the chickenpox vaccine, although it's a great idea for a lot of different kids, especially kids who are at extreme risk. I didn't vaccinate my own kids with chickenpox vaccine simply because I did not, because I would rather them get the chickenpox when they were young and then have lifelong immunity as opposed to having to either A, get revaccinated when they were older, or and things like that. I was worried about them being at risk when they were older. In other words, getting the disease and having any sort of sequelae, be it pneumonitis or neurological sequelae, when they were getting older. So that's what I actually did with my children. My kids are 4 and
So now though, like, in terms of, and I understand what you're saying about that is, but now like we're at a point where she got yet, she's 7, she's been around a lot of kids for
Yeah,
7 years.
say,
Do we then try and push her to people who are having, so she gets it young, or, you know, it's like,
Yeah, I mean,
you know, you never want to do that, but at the same time, we don't want her to get it when she's 22.
well, my mom did that. She made me play in sandboxes with these kids with chickenpox, and I was mortified. And I never got it until 2 years ago. I finally got it 2 years ago. It was a night.
I got it when I was in my 30s, and it's not a lot of fun. I mean, I don't know, it's a tough issue for all of you. And, you know, you guys are doing a great job with this, and I knew that you would. I have to say that the reason I asked them to do this, you know, this is a group of parents that really is a very small reflection of the parents that we have in the Association of Children who have TM from all over the world. And in fact, the vaccination issue was really put squarely in front of our face by the Aldertons in Baltimore. That's really why we spend so much time with it, because of their concerns about Luke. I have to say I get a phone call from a parent maybe once every month or a month and a half. I get a phone call from attorneys who want to sue somebody about this, you know, once every other week.
Don't send them to me.
And I try not to. So it's an important issue. I think it's really it's an important issue that we continue to talk about. I'm glad you have the opportunity to talk to the doctors about this today.
It's hard to not get chickenpox. I mean, it's getting increasingly hard.
Yeah.
So, I mean, I finally gave it to my mother, even though I was, you know, kind of opposed to it. I didn't, not because I was very fearful of a reaction, but I just didn't think it was necessary. And we don't even know if you get the vaccine, will you have lifelong immunity to it? We just don't know that. Right? Is that true, Greg?
It's not. Likely it's not. Probably.
Having said that, you're probably less likely to get shingles, zoster, if you've had the vaccine than if you've had primary chickenpox, in which the virus goes. And so I just don't know. But it's hard because as she goes into school and daycare and things, it became very difficult to fight that. So I finally gave in and she got it.
Is there any,
Question, yeah.
is there any information on, or any known association between the use of antiviral agents and TM, such as acyclovir? That's very popular attempt to prevent chickenpox.
Whether or not it works in the acute phase, giving acyclovir with anti-herpes virus drug, whether or not it modulates acute transverse myelitis.
Or is subsequently associated with
Is what subsequently so?
the use of the antiviral as a theoretical agent that might trigger some.
I've never heard of that. We have used it as an acute treatment, especially in particular cases in which a patient will describe the onset of a burning kind of radicular root-like pain, sometimes with vesicles, sometimes not. Well, that's shingles. And that is actually due to a reactivation of a previously latent varicella zoster virus. Well, what happens is it spreads out as you kind of get sick, have a little bit of cold. That's shingles. Sometimes it doesn't just spread out, it spreads back in to the spinal cord and will cause a zoster myelitis. Herpes simplex 1 and herpes simplex 2 will. We can try to figure that out in the acute phase, and patients will get acyclovir in the acute phase, and I'm sure that it works. In fact, if you have a zoster or a herpetic myelitis that you initiate acyclovir in quite early, it almost always goes away for the most part completely.
What happens if you don't give a booster shot for chickenpox? Our older daughter Erin had her gave her chickenpox shot, and now she's got something. I'm not sure.
I don't know. What, it's recommended 2? Right? 2 doses?
Pediatricians, 2 doses? Have to ask them.
2.
Our general pediatrician. Changes.
My daughter's only had her first one yet, so I haven't gotten to that
When
phase.
you're supposed to get the booster?
No, I have to say, I have to cancel on that. It's
Probably about 10, maybe, somewhere around there.
So
10 to 12.
you're wondering whether or not you should give the booster. I don't know. I mean, again, this is a sibling thing. This isn't the child who's had transverse myelitis. I think that risk is exceedingly low. You know, the other way to think about that is you've already induced the immunity from the primary. It's just raising it a little higher with your booster. So it probably lowers your chance of having an untoward reaction even more. It's probably a vanishingly small risk.
I just was wondering if it would be a risk to not, chose not to give it to causing harm.
Oh yeah, you would have more transient immunity to varicella, and your risk of primary pox would be present, greater than if you had done the booster, and all of the sequelae that could happen from chickenpox, which in most cases none, but possibly.
My nephew had a shot at chickenpox and he got the chickenpox.
Right. It's I think it's still what, 80% or.
Yeah, it's very mild.
The other thing is the infection itself. You know, we see something called post-cereballitis. It's a condition where part of the nervous system, the cerebellum, has a reaction somewhat similar to TM, but usually with complete recovery. So the virus infection itself is also, there's also risk of causing neurological injury. You know, so I think you just kind of have to make your decision and get your physicians to support your, if you don't want to give it. I did. Yeah. But they got chickenpox, so I didn't have to give them varicella. Yeah.
The other thing about your child that points out is, again, individual susceptibility when you get vaccine. When you give vaccines, how does the body react to the injury itself? What I term the host response to injury. Again, I mean, it brings up the whole point of what Doug was saying. To follow these people prospectively would be a great thing. Looking at family histories of having allergies and autoimmune disease and things like that, because it may be that among the whole population of TM, the risk of a TM due to vaccination is exceedingly low, but among a small group of patients that have a certain group of genetic predispositions, it may be quite high. So it always begs. I think parents have a valid question when they talk about whether it's an association or not. And certainly it's worth talking to your doctor about because there may be something in your family history that's important that may put you at risk. If I had a family history of autoimmune disease, I would want to say it first.
Sandy is, oh, go ahead, and then Sandy.
Well, my question sort of follows along through. So my son has had what I would qualify as allergies, he had tons of ear infections, had tubes, had the asthma prior to having TM. So the question I have, I've had him vaccinated with the flu vaccine because when he gets sick, he does get upper respiratory problems. Of course, not since he's had that, I think he's had pneumonia 3 times. So I decided that the risk of pneumonia from flu is higher than my risk of him having TM or whatever.
I think that's an excellent
But on the other
decision.
hand, he has like this allergy problem. You know, I do think he has a sort of pre-existing allergy problem. So, you know, but I rated that the risk of pneumonia was higher.
I think that's exactly right for your son. Living with both a wife and a child who has bad asthma, and having been in the hospital a couple of times with them, I think you made the right call. No matter if your child had TM or not, I mean, I would do the same thing. You know, it's again balancing the benefit versus the risk, which I think is the decision that you have to make with regard to vaccination.
Yeah, I think you're right. I mean, flu kills. I mean, flu kills 34,000 people per year. And that's right, especially young and especially old, but also anybody who's got any respiratory difficulties puts them into that high-risk category. So a vaccine there is not, I mean, I would say yes, absolutely yes. To where I'm waffling on the chickenpox, I don't waffle on that at all.
What about the pneumococcal vaccine?
I'd say that probably the best thing to do
pneumococcal vaccine is what, a 23 strain vaccine for pneumococcus, which is a major cause of pneumonia.
But it's also a major cause of
Ear infections, pneumonia, sometimes meningitis.
Which is obviously what the neurologist thinks about. That's why you'll hear a neurologist
And
say,
with-
give the pneumococcal vaccine.
And with emerging resistance, I would say yes to that too.
What's the resistance now?
I don't know.
Resistance vinegar pneumococcus is like 20% now.
Yeah.
20% now. It's not insignificant. Those bugs are getting smacked.
So in your adult TM population, had any, I mean, do you recommend that they go ahead and get a flu shot then that have had it? Okay.
I do. I do. Why?
Well, he said,
We try to remember the reason why. I think he didn't feel it was much better than we talked about last, but it's kind of an issue that comes up in the fall. And,
Does Jason have problems with breathing?
he does have some, yeah, when he gets sick, he does need some assistance with not a ventilator.
What would you say, Greg?
I would say if he's at risk for breathing, I would ought to get his flu shot.
I guess as we think about it, it's an issue we probably need to address each fall.
Yeah.
Yeah, exactly. I mean, if he's, but you know, if he,
That's true what you just said, that they found adenovirus and what else?
I can't remember was A or B, but those are the two things that they rule out.
Do you remember if that was from the spinal fluid or from... It doesn't change the way I think about it, but that's very interesting. Adenovirus has been shown to cause transverse myelitis. I'm not aware of influenza being reported as causing transverse myelitis, so I don't know what to make of that, but I still probably would.